By now, you have definitely heard about the novel coronavirus, also known as the novel COVID-19. It is causing alarming concerns globally, and as we speak, it's also the fastest spreading virus known to us. COVID-19 is one among a large group of viruses that cause diseases in animals and humans. Their name comes from their crown-like edges or spikes, as you may observe on the surface. Cases have been detected in most countries worldwide, and on the 11th of March 2020, the World Health Organization categorized this outbreak as a pandemic. Not a small term to use in today's day and age, with 163 countries reporting cases. But the purpose of this video is not to re-inform you about the coronavirus. Instead, it is to give you a clearer idea about the situation in Italy. Some groups choose to spread manipulated and incorrect information about the virus. How does it help them? Well, most media houses today struggle for your attention, and clickbaits might just be a part of their strategy to convert you onto their platforms, which in turn gets converted into numbers rolling into their bank accounts, also known as advertisement money. Additionally, we cannot rule out the fact that Italy communicates most of its information in Italian, which makes most people averse from delving deeper into the truth as well. Well, one such clickbait or incorrect piece of information being spread is how Italian hospitals are not managing the situation well, which is not just far from the truth, but is actually just lies. Yes, the death toll in Italy today has crossed the 4,000 mark. Definitely a shocking number. But I believe we need to ask some atomized questions here. How are the numbers this high? And why are the numbers this high? To begin with, the total population stands at approximately 60 million. Here is an approximate age distribution. 13% of the population is under 14. 64% lies between 15 and 64. And a whopping 23% of the population is above 65, thus making Italy the second oldest country, only after Japan at 26% and followed by Germany, which stands at close to 21%. This does not mean that those who are younger are immune from the virus, but it is to give you an idea of how the older population is definitely more susceptible. This, coupled with what will be shared now, should give you a broader perspective. To provide you an intuitive understanding, the medical system among the 20 regions in Italy work in a rather decentralized fashion. By law, the public healthcare provides a universal health coverage for everyone on Italian soil, which includes foreigners. There are certain caveats to this, but not only is the medical infrastructure in most cases free to access, but it's also state-of-the-art. WHO has ranked it second among 191 countries. Having a form of a decentralized aspect also means that the reporting standards are very transparent and thoroughly professional. If you were to call in the number 1500, you will have a health operator ask you a few basic questions, and in case the professional believes you might be infected and your situation is grave, an ambulance will be under your doorstep in a matter of minutes. You then might be moved to the nearest hospital in something known as the pronto soccorso, also known as the emergency ward. But after this, you will have all your data reported to a central body, which then counts you as an infected patient onto their database, which, as stated earlier, is transparent, honest, and completely reliable. You could check this out for yourself at the following website, Protezione Civile, and click on La Mappa della Situazione on the left-hand side. A desktop and mobile version are both available. Italy is putting the health and well-being of its people at the forefront, instead of focusing on economic numbers and taking strict measures to ensure that the virus is brought under control at any cost. What we should be concerned about now is whether other countries are being ethical in their reporting standards. Reporting should not be confused with the presence of the virus, because it's likely that the number of those with the infection are much higher than the reported numbers in many countries. During these sensitive and trying times, it is important we support one another, follow the strict health guidelines, and do all what it takes to support the real heroes and angels in this fight against coronavirus. Our medical professionals, doctors, nurses, emergency experts, and the on-ground task force. 13 to 14-hour shifts, the professionals are overly exhausted and working beyond their capacity. One should do all what it takes to not just protect themselves, but also protect our heroes in such tense circumstances. Do not forget to like, share, and subscribe to this channel. You could also support a long and committed creative process on Patreon. The link is in the description below. Stay tuned for such informative videos, where we break down things into their most indivisible form, atom by atom.